My name is Derek Yates. This is my head-to-toe assessment for Dr. Pleshkin's 2025 fall semester Nurse 7101 head-to-toe assessment. I'm going to scan the room. And then I have my supplies there. This is my patient Natalie. For patient privacy purposes, prior to beginning the examination, we disrobed, did a complete skin check. There was no lesions, scarring noted. Her skin is normal for ethnicity. It is warm and dry, and turgor was intact throughout. We are going to check head for symmetry, which is cephalic symmetry midline. I'm going to look through the head, tell me if there's any tenderness in your hair or scalp area. No tenderness noted. Hair is healthy, porous, equally distributed. There is no evidence of lesions, crepitus, or parasites. I'm going to check lymph nodes. We've got preocular, postocular, occipital, tonsillar, precervical, postcervical, subclavicular. No nodules were noticed throughout. I'm going to test for cranial nerve number 5, if you can clench your jaw. Good job. And now with your eyes closed, I would like you to tell me which side or where I am touching on your face.
Forehead. Left cheek. Right cheek. Nose. Chin.
Cranial nerve number 5 is good. To test cranial nerve number 7, I'd like you to raise your eyebrows and then relax, and then puff up your cheeks, purse your lips, smile, frown. Symmetry was noted throughout. And now, I'm going to do cranial nerve 3, just look straight ahead. Pupils are equal, round, reactive to light. Now I'm going to test for convergence, if you can just look straight ahead. Accommodation and convergence were noted. Now we're going to test for cranial nerves 3, 4, and 6. Just follow the light. Eye motions were smooth and noted throughout. You can examine your eyes. Conjunctiva is pink and moist with no discharge noted. Sclera is white. Look straight ahead. Ret's reflex is intact. And internal eye structures present and normal. Now I'm going to whisper 2 words, and I'd like you to tell me what I'm saying. I'm going to plug one ear for this, okay? Dog.
Dog. Cat.
Job.
Cat. Dog.
Good. Hearing was noted on both. Now we're going to do the Weber's test. Tell me if this sound is equal on both sides.
Yes, that's
Lateralization was noted. And now tell me if sound 1 or sound 2 is louder.
2. 2.
Ryan's test was Good. We're gonna go for the nose. Nose is midline symmetrical, no deviation noted. If you can plug one nostril, please close your eyes. And then take a deep breath in. Tell me what you smell.
Vanilla.
And then do the same with the other side.
Vanilla.
Cranial nerve 1 olfactory is intact, as well as good inhalation through the nose. Now we're going to look at your mouth. If you can open up wide. Soft palate is moist, no signs of lesions. There are some fillings noted. One crown. Tongue is midline. Stick your tongue out. Please say ah.
Ah.
Tonsils are 2+. Tongue is midline with no subluxation. We've got cranial nerve 12, which we can see from the tongue being midline, and 9 and 10 from the uvula's movement. Which is all great. I'm going to palpate for frontal sinuses, maxillary sinuses. Any tenderness there?
No.
Good. Now I'd like you to turn towards the corner. And then just breathe normally. No retractions are noticed, no use of accessory muscles, no evidence of cyanosis, and chest is moving symmetrically. Lean forward, take a deep breath in. Respirations are symmetrical on both sides. Now I'd like you to say 99.
99. 99. 99.
Tactile firmness is checked. Now we're going to check for esophagy. I'd like you to say the letter E with each touch.
E. 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 E.
Esophagy is negative, and now say 99 with each touch.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Very good. Now I'm just going to listen. Just take deep breaths. Okay. Very good. You can turn back around. First, we're going to check for tactile firmness on the anterior chest. See 99.
99.
Again.
99. 99.
Thank you. Auscultate. Now we're going to listen to the heart. We're going to start with the right sternal border, second intercostal space for the aortic. We're going to go pulmonic, left sternal border, second intercostal space. Erb's point, third intercostal. Fourth intercostal left sternal border for tricuspid. And then fifth midclavicular line. Fifth intercostal space for the mitral, which is the PMI. And I'll listen here for 1 full minute. finding S1 and S2 with normal sinus rhythm and apical heart rate of 98. If you can lay down, please. Okay. Looking for symmetry. And now I'm gonna look for jugular vein distension, if you can look one way. No jugular vein distension noticed. Nothing rising or sinking. Carotid on the right side is 2+. And now look the other direction, please. No jugular venous distension noted on the left. Carotid is 2+. I'm going to listen for any bruits or thrills using the bell. Negative left. Negative right. You can listen to your heart one more time. Right second intercostal space on the right sternal border, pulmonic. Aortic, pulmonic, left intercostal, left sternal border, second intercostal space. Herb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And then mitral on the midclavicular line for PMI. Now we're going to look at your abdomen, if you can just keep your hands to your side. Abdomen is symmetrical at midline and flat. No notation of scarring present. I'm going to start by listening to your bowel sounds, and then I'm going to listen to your arteries that are in your lower extremities. So we're going to start with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, normal bound sounds heard throughout, normoactive. Now we're going to listen aortic, renal artery, iliac, femoral, renal, iliac, femoral. Lay that throughout. Now we're going to palpate, and just let me know if you feel any pain or tenderness. Now we're going to palpate for the liver and the spleen. Any tenderness there?
No.
Liver is making a dull sound. We've got resonance throughout the abdomen. Can you sit? Okay. Now we're going to test your fingers. If you just hold them straight out, we're going to extend, hyperextend, flexion. Good. And now wrists, we're going to do radial deviation, ulnar deviation, rotation. Good. Now finger to finger. Good. Do your thumbs in. Good. And then I'd like you to put your finger to your nose, and then touch my finger, and then back to your nose, and do the same. Doing great. There you go. And now finger to finger. Same. hand. Just down. And then back up. Great. That's a test. Okay, and now I'd like to have you grip my fingers and then squeeze. Squeeze hard. Equal strength on both sides, 5 plus. Push up against my hand. Good job. Push against my hand. Forearms, bicep, both noted to be 5 plus. Now I'd like you to flex your arms out. And extend. And hyperextend. Good. Got there, and then you can stand up. We're not doing that yet. Thank you. Now we're gonna face the camera, please. And now we're gonna do shoulders. So we're gonna do internal rotation, and then behind you for extension, and behind hyperextension. Same with the other hand. I know you can't see me, I'm sorry. And then arms up and out, and then rotate. Good. Okay, and now you can sit back down for a moment. And now we're gonna do strychnosis, which is identifying an object. So if you can hold your hands out and keep your eyes closed, tell me what this object is. Yeah, and give me your other hand. And tell me what this object is.
The marker.
Correct. And now for graphisia, I can hold both hands out and then tell me which letter I'm writing.
I.
Yeah. Let me do that one more time.
M.
Correct. Just perfect. I'd like you to stand up now. And then face forward. And then I'm going to palpate. Bend a little bit. Right here. Any tenderness through there?
No.
CVA negative. And then we're going to stand up and look straight ahead. I feel like I need to move that back a little bit. I'm going to. Okay. So we're going to do your hips now. So I'd like you to extend your foot forward, and then you can put your feet, and then internal rotation, external rotation, same thing with the left foot. External rotation, internal rotation, and extend out with the other leg. Good, good. And then circumvent, and other leg, circumvent. And then same thing with the knees. Good. Kick your leg out. Good. And left leg. Bend the knee. Good. Kick your legs out. Good. You can sit back down. And now I'm going to assess the lower extremities for any edema. No edema noted throughout. No redness or stiffness noted in the joints of the ankles, of the knees, of the wrists, or elbows. With your toes, I'd like you to flex them in, clench them in, and then extend out, and then extend up, then ankles down, dorsiflexion. Good. And then push down like a gas pedal. Strength +5, both bilaterally, and then up. Good. Strength +5 bilaterally. I'd like you to push against my legs, arms, hands, whatever they are. Strength bilateral 5, both sides there. And now we're gonna test your reflexes. Achilles. Achilles. Ulnar. Ulnar. Bicep. Bicep. Tricep. Tricep. And then tell me if the sensation is equal on both sides
Equal.
for light touch.
Equal.
Good. And now we're gonna test for vibrational sense. You feel that on your ankle?
Mm-hmm. Mm-hmm.
Okay.
Mm-hmm. Yes. Yes. Yes.
Okay, so now stand up, please. And then I'd like you to face the wall. And I'm going to assess your spine. Spine is midline, no deviation, no deformities. Bend forward and bend all the way forward, bending your spine. Good, and then straight up, and then bend back and extend, and then hyperextend. Good, and then back to normal position. Chin to chest, then look up, then look way up and hyperextend. Good, and then cervical rotation. I'm going to have you look at me, then look the opposite direction, and do a good full head roll and rotate everything there. Looks good. Okay, and now I'd like you to come back to this wall. And then I'd like you to walk forward. And then, good. Turn around and then heel to toe walk back towards me. Gait is normal and symmetrical. Heel toe walking is good. Coordination is intact. Now we're going to have you stand here. And then I'd like you to hop on your right foot. Good. And then hop on your left foot. Good. And now we're going to do the Romberg's test. I'd like you to hold your hands up and straight out. And I am not noting any deviation or swaying whatsoever. You can relax. I believe that completes my head to toe. There's not in the camera again. Hello. Head to toe, complete.